That's Michelle and Janki, right?
Yes.
All right. Nice to meet you both. Thanks for joining us today.
Thanks for having us.
Yeah, I was just telling everyone about the Toolbox series. So if you guys, I don't know if you've been tuning in at all, but our objective is to put tools in parents' toolboxes because when we know better, we do better. And many of us, if we're first-time parents or even, second multiple kids, if you don't experience it yourself, it's hard to know what what you don't know. You don't know what you don't know. And so our point is to try to get everyone some more tools so that when you know better, you can do better. So thank you for joining us today. We're really excited to have our first session with some speech therapists.
Thank you. We're excited to be here.
Cool. All right. Well, I like to start every Toolbox series with kind of you guys taking a moment to tell us how you found yourselves along this path, this journey. And so why don't you guys go ahead and kick it off?
Okay.
All right.
You got it.
So my name's Janki. I have been a speech therapist now for a little over 5 years. And I was always kind of interested in working with kids, and I was trying to figure out, to what capacity do I want to work with kids and how do I want to support. And I just kind of fell into therapy, and I've trialed both occupational therapy, physical therapy, and speech therapy. And I'm a talker, so speech therapy was natural for me. The more I learned about it, the more interested I got. And, going into pediatrics was really natural as well. I had grown up with, little kids and cousins and all that. And I'm an older sister, so, helping to raise my brothers and sisters, it was really fun. And, it was kind of just natural. So, yes, that's how I kind of got here. I've worked in schools and clinics and private practices. And here I am now.
Excellent. All right. And how about you, Michelle?
My name is Michelle. I have been a speech pathologist for about 3 years now. I originally got into the profession because I wanted to work at a school. I always wanted to be in that school environment. I always wanted to kind of get to know the kids as they go throughout their day. And as I learned more, I was just so drawn by the range of places you can be and the range of things you can do as a speech therapist. So I've done a little bit of research work, a little bit of work in early intervention, and now found myself in the school again. So I just like forging those deep relationships with parents and families and teachers and kind of the whole support system.
Excellent. That sounds good. So it sounds like, Janki, you say you're a talker. When you decided to become a speech therapist and told your parents, were they like, of course?
Surprised I didn't want to be a lawyer. Because I also, love to argue with them.
That's funny.
So they were more like, are you sure you don't want to be a lawyer? And I'm like, yeah, sure. They didn't quite understand what speech therapy was. And I think I've met a lot of people in my day where they're just like, what exactly is a speech therapist? What exactly do you do? Do you help people with accents? And I'm like, oh, we do a little more than that.
Well, why don't you guys, so we have people joining who may be new to speech therapy, right? I've experienced it through one of my kids, but I can't begin to say that I understand everything that you guys do. In fact, when I sit down with her speech therapist, I learn so much. And so why don't you guys kick it off with kind of like what speech therapists do and kind of the gamut of services you guys can provide, because many of us as parents, if we have utilized or come into contact with a speech therapy or speech services, we probably only see a fraction of it, right? So maybe if you guys can give a broader picture of what all that you guys encompass, that'd be great.
Yeah. So we really work with families or individuals throughout their lifespan. So we can work with them when they're babies in the NICU, helping them with feeding, helping them develop those good attachments. We can work with kids in schools. We can work with adults in hospitals who might have suffered a traumatic brain injury or a stroke or some kind of muscular type of disorder. So we really work with people throughout the age range to find their voice, whatever that is, whether that's through speech, whether that's through picture communication systems or some other type. We're just helping people communicate what they need to say, what they want with everyone around them.
Oh, wow. I didn't realize you guys started so early, like as a NICU with kind of suckling and attachment. That's crazy. I had no idea. Perfect example. This is perfect. I so don't know so much stuff, so it's perfect because I'm a parent And I learned so much in every one of these toolbox series, which is great. So did you have anything to add to that, Janki?
Yeah, I just wanted to mention too, like when it comes to seeing the child as a whole as well, we're looking at social engagement and also just kind of oral facial muscles, and we're looking at all these fine-tuned things. And so you'll find a lot of speech therapists who specialize in their own niche.
Okay.
So, you know, because it's such a broad spectrum and because it's such a wide range of ages that we work with, in so many different settings, we do have our, you know, like niches and our specialties. And as we kind of develop as speech therapists, we kind of find that niche for ourselves. And so, you know, just like you would, you know, get a specialist for, you know, your eyes versus, you know, just, you know, a screening versus, you know, really getting deep into like LASIK or something. You would speech therapists as well, and that goes for all therapists, you know, even OTs and PTs.
Well, we're talking to parents. So what I kind of like to address is I kind of phrase it as when to worry. So it kind of brings us back to milestones, and maybe you guys could talk a bit about the milestones that we as parents, you know, are the typical milestones, and then when parents should worry, because, you know, I don't want parents, I say the word worry, but I don't want parents to lean into it, because the bottom line is like, when you know better, you do better, right? And so lean into it. Don't be afraid. If there's a stigma or anything, you know, regardless of the topic, don't be afraid, lean in, because the sooner the better is always the case, right? The sooner the better. So maybe you guys can talk about milestones, and then when parents, you know, not worry, but can kind of like say, okay, well, maybe we need to figure this out. And then they go get the tools that they need to lean in and figure it out.
Yeah, for sure. I think in general, as a speech therapist, we like to tell parents, you know, look at, instead of, you know, counting how many words they have or how many sounds they're making, or really trying to get like too strict or tunnel visioned into, you know, like, oh, they're not meeting this marker, because there's such a range. And kids at that age, especially in the first 3 or 4 years of their life, they're really growing at their own pace.
Mm-hmm.
So it's really hard to say, like, you definitely have to have this by this age, you know?
Right.
So it's, you know, we try to ease a lot of parents' anxieties about that, you know, like, oh, they're not saying their first word yet, you know? So what we like to see is that we, you know, at least the kids are making their first intentional word at 1. At 12 months. So essentially what that means is, you know, they're not imitating the word. They're really asking spontaneously on their own, independently, asking for, you know, either their mom or their dad or their binky or their water or their milk, and they're intentionally making that communication attempt. And it doesn't have to be a clear word. It doesn't have to be completely right. Like milk is a hard word. We don't want kids to say milk age 1, but, you know, if they're getting pretty close, then that's pretty, and it's super intentional. That's really that's what's important. And usually from there, their language and their vocabulary is going to really start to blossom and grow. If they're not doing it by 12 months, that's okay. There is a range. And so, you know, even 18 months is okay. Something like that. The biggest thing here is we really want to see them at least babbling and making those attempts to put sounds together and to create words. Whether they're accurate or not is really not what we're looking for right now. At 1, we're really just looking at like how intentionally are they communicating. Similar to at 2 years old, we want to see them start to put some small phrases together, like 2-word phrases like mommy more, or, you know, no, I can't think of it on the top of my head.
Want, wawa, want water, you know, just kind of combining some things intentionally. I feel like a lot of times the first phrases we see are a lot of requests, because that's so motivating, you know, they're so dependent on you, but that's not to say that's all you could have. You know, you can combine, you know, adjectives and nouns and things like that. Just kind of starting to build those phrases. And I think something parents can do to really help grow that from that single level is modeling those 2-word phrases. I think we all tend to talk, but really once they're in that 1 to 2 year range, you want to kind of meet them where they are and give them phrases they can understand.
Gotcha. Like more food is common in my household with my little eater. Big. But and what are your thoughts on sign language? Because I think a lot of, you know, more food is kind of common. Some people do it together, but they're saying both. I have heard, and I haven't researched or anything, but sometimes, you know, it's easier for them to make the kind of the motions than it is to articulate. Is that something that you guys have an opinion on, or?
Well, I think that kind of brings like a really important point, which is that when you're using a word to describe something,
Mm-hmm.
expressive communication, which is actually really advanced from a language perspective. So there are actually all these other things we see a lot of times before we even get to a verbal word. So, you know, you're seeing intentional eye contact. When I look and point, are you looking at something and pointing? Are you able to imitate my kind of gestures? I mean, if they have a motor kind of delay, sign language might be tough, but you're thinking about all these other things before you even get to that word, and gestures are a huge part of that. And I think that drawing a baby's attention, or you know, a young child's attention to your body by using sign language can be a really powerful visual cue, because really you're just trying to draw their attention to you. If they're having trouble responding to those words, that might be a great way to bring them in. Might be a great way to bring their attention closer to your face to help support that verbal word, and just really support that receptive understanding piece, which usually comes before that expression.
Right. Gotcha. Yeah. Because I don't remember what age, but it's funny to, you know, test them to see if they can actually look where you're pointing.
Mm-hmm.
Yeah.
For a long time, they don't, because it's like, well, what are you doing? Like, I don't, you know, it's a long leap to look to where my finger's pointing. And I was a psych major, so all these are little wrinkles, stuck in wrinkles somewhere. And I think, oh yeah, that's actually developmentally kind of complicated.
Yeah.
To follow that pointing direction. So no, so it makes sense. So really, you kind of combining the both is perhaps best if you're going to be doing the signs, so that they kind of start understanding more food or
language for sure is like one of those, it's a gesture, right? Like you're gesturing, but what the goal there is that you're having intentional communication. And so you're engaging, you know, whether it's verbally or non-verbally, you're engaging in communication. So you're bringing that other person in, you're sharing your ideas, you're expressing the things that you want. And that doesn't always look verbal. You know, a lot of times it can be gestural. And a lot of times, even as adults, we're pointing at things like it's over there, you know, but it's like over where? so gestures as well. And really what sign language is teaching the kids, if, you know, they're not ready for that verbal speech yet, which, as Michelle mentioned, there's so many other precursors that have to happen before we can even work on expressive language. So gestures are a great way, and, you know, sign language is a great way to kind of just teach the back and forth of communication of, you know, I do or say something to communicate my thoughts and needs, and you respond to that.
Yeah.
That back and forth is really what we're trying to teach there. And then pairing that then with verbal language is a great way to kind of bring in the verbal piece. But it helps build a bridge for kids, because if they're not quite ready to make those movements with their mouth yet, they could at least get their communication and their thoughts and their ideas out in a communicative way without feeling frustrated. Because I think a lot of times that's what parents will tell us is like, well, she'll get frustrated if she's not able to tell me what she wants. It's like, well, yeah, wouldn't it be frustrating if we weren't able to verbally communicate, you know, what we wanted, and we didn't have the gestural tools yet to be able to communicate. So,
well, you guys make some great points, because it's an amazing reminder at how complicated, you know, what our little ones are having to take in, synthesize, and then, you know, start the learning curve. I mean, it's just amazing, because I even in my personal parenting journey, you know, the transition from purees to solids has a lot to do with speech, in terms of mastication and, you know, the muscles and the ability to, you know, articulate, right? Because I just heard something recently, speaking versus articulating. Like, you know, speaking is them trying to utter, and they're talking, but they may not be articulating, which is very different, so that, you know, some people can understand it. But it's just the respect for the little ones and their journey is real, right? It's a lot
to talk. Yeah. You know, it is amazing.
It's a lot to talk.
That's a really good point that, you know, Michelle and I were talking about earlier, is that when babies are babies, like they're only a couple months old, what they're doing is they're taking in the world. They're just absorbing everything that they're seeing, that they're hearing, that they're feeling, and through all their sensory systems, right? So I think that that's really important also as a precursor to that verbal speech, is that, you know, if you think about a baby, even at like 3 months, they're watching your face, they're watching facial expressions. They start to imitate those facial expressions. They're starting to watch your mouth as you make movements and as you produce speech. They're just watching and logging all of those motor movements.
Yeah.
And there's such fine motor movements. So it does, you know, it's really hard for a kid, let's say, who might have some weakness in their, you know, facial muscles or their oral muscles, to be able to imitate then, you know, those kinds of movements. And so sometimes that's where we'll start to see some delays. So it starts really early on. And so those are the kinds of things that as speech therapists, we're always letting parents know, you know, like, how was their eye contact? You know, how was their ability to, maybe not eye contact, but just tracking your face, right?
Mm-hmm.
Like watching your face.
Interest in you.
Right, exactly.
Yeah.
Are they interested in the parent, like watching the parent's face, you know, something like that. And we were talking about how screen time has become such an important topic these days, but parents have a hard time kind of understanding why. Like, they hear, oh, screen time's bad for your kids, but like, why? You know, like, what's really happening in our kids' brains? And so we had talked about, you know, something that isn't quite researched enough yet, but it sounds like it makes complete sense when you're like, oh, if kids are so stimulated by screens or by motion, even by motion toys, that move with battery power operation or
Sure.
up,
Or that noise is coming off of them.
right? Their brains are stimulated in a way that our faces are just not able to match. You know,
So it's like the face is like, wah, wah.
yeah, exactly. The
Exactly.
face is kind of
Makes
just,
a lot of sense.
you know.
Makes a lot.
And so, you know, when you're getting all this stimulation and you're like, oh, like, my brain is really active right now, you know, because it's seeing all these lights and the movements and the noise and all things, our faces are just not, they're not really.
Yeah, they aren't hacking it.
Exactly. So it's really hard for a lot of kids to focus on watching their parents' mouths to then imitate those, you know, those speech movements and those oral movements to produce accurately. So a lot of times we'll see that, you know, that it starts really early on. And when they're getting those screens really early on, their brains need that kind of activation to feel stimulated. And not getting that, their brains are bored. And so it's just not enough stimulation for them. And so then they miss all these little precursors kind of leading up to the important stuff, which is, you know,
the connection.
The social.
That's interesting. So I've got a question. At what age, like, is there a range that you kind of typically start seeing your clients they've been referred to? And we'll get to kind of how parents kind of get referred in the first place, which harks back to the when to worry. But at what age are you starting to find your youngest come to you for services?
Well, in DC area, I mean, for a lot of states, there are those federally funded prevention programs, which, I mean, kids who automatically qualify due to some secondary diagnosis, like if you're found to have hearing loss or, you know, some other kind of criteria that could funnel you right in. You can actually qualify for speech services just based on an initial referral. I mean, we had kids as young as 4 or 5 months, you know, just coming to us, who we knew had a high likelihood of having difficulty learn to communicate. And with that, tie it with the feeding piece, you know, when you're breastfeeding or when you're bottle feeding, that's like prime face-to-face bonding time. So, you know, really setting up babies for success. I mean, you could really start at birth. You can have a of knowing who might benefit. But I think a lot of times that 1 year mark, that 18th month mark is when a lot of families start to realize, oh, you know, so-and-so's cousin, he's combining 2-word phrases. He's not really having that single word yet. And I think a lot of times they get the, you know, wait and see. But really, if you have a federally funded program to have that will give you an evaluation, I think if you're concerned, you know, you have that service available to you. So you really could start at birth. Yeah.
So for the parents who are kind of maybe, okay, that little thing that's been nagging me in my brain, would you recommend that the best place for them to start is their pediatrician and express their concerns? And if their pediatrician said, no, you know, this, not now or whatever, and they still have that nagging feeling, where did they go after that?
So I think the pediatrician is a great place to start. I think they can some great resources and can give you some things to look for. But I think that, you know, there can sometimes be those markers, those milestones that pediatricians are marking your child's progress on. But it really is so much more than, like Janki said, the word count or this, what they should have by this age. So I think you really have to kind of widen the lens to see, okay, are they socially interested? Are they having trouble following directions? Are they having trouble kind of babbling or playing with sounds? And the more kind of boxes you're noticing, some kind of your brain is kind of thinking, the more I think you should probably take a look. And you would just get more information. And I think the pediatrician would be a great person to kind of put you in contact with the right people. But I think if you're concerned, even if your pediatrician is saying wait and see, I think it's worth getting more information.
Yeah, and going directly to probably a speech therapist or even an occupational therapist would be great to start, because they're going to be more specialized essentially in looking for these things and looking for those precursors than, your pediatrician who's looking at just, more so the child as like from an outside lens. So, we're going to be able to kind of tell you a little bit more deeply about like, oh, I'm noticing that they're not really imitating gross motor movements or, fine motor movements with their fingers. It's going to be really hard for them to imitate oral movements because that's going to be your most fine, fine movement. So motor movement, sorry. So, I think at that point, like, pediatricians will hopefully refer to us, and that's where we kind of be able to fill in those gaps. And like Michelle said, it's just an evaluation that kind of gives you that more information, and sometimes therapy would be helpful and beneficial, and sometimes it's it is a wait and see. So and like I mentioned before, is like these kids are they're growing so quickly and they're growing so fast that sometimes wait and see is okay. It's really okay to kind of like, let's wait and kind of feel this one out. Or, we're starting to see some pink flags, maybe not red flags yet, but
I like that.
That would be a good place to at least say like, hey, let's see if we can kind of enhance or enrich their language or their play skills or their social skills or their regulation. And I think that might help kind of boost them up to that next level. And sometimes that's all it takes. Sometimes it takes a little bit longer and a little bit more intensive therapy, but that's going to be on the professional and kind of what they're noticing.
It was interesting because the way that we found the need for speech therapy was actually referred to us by medical professionals who responded to my comment that our daughter showed an early preference for left-handedness, in fact, and kind of their key for because it was far earlier than normal, I guess. And it's interesting to me. I just wonder. I'm not necessarily asking, but based on what I've kind of know about the brain, right? It goes cross. So left-handedness is right brain, right-handedness left brain language. That maybe I would venture to guess that the kids that you may see, there's probably more left-handies than rights because of that. And it was really, she's left-handed, and it was really amazing to me that I read about some studies that were done about the handedness, and I just thought, gosh, I would have never really, I didn't give too much thought to it, but when they're like, she showed an early preference for left-handed, I'm like, yeah, she's left-handed, I know it. And they're like, huh. And then they got us into services. So is it just interesting? Like, that's another random,
I've never heard
that. I've never heard
so it might be something that, you might be onto something, honestly.
Well, it's just, the body process, right? So the hemispheres and that one more fired up for the right brain versus the left brain when they're right-handed. And so I wonder, what's that?
Might have to ask our OT friends about that. They look a little bit more at the handedness.
Yeah. I mean, I'm no doctor, but I was, there have been kind of studies, I think, I don't know that they're like really like, that's it. But it makes sense. And so I wonder if you guys were to just talk to your speech therapist friends and see if they're more left-handed than there are right. Not going to be foolproof, but that would be interesting to know.
That would be, that definitely puts a little bug in our ear to like,
right.
To see.
So, having been through speech during COVID, are you? It looks like you guys are maskless, which is great. I found it very difficult to do speech with masks, and also very difficult to do speech over Zoom, because they're little, and it's like, okay, I'm over it. The attention span is not like 30 minutes when there's not, so many things that they can actually touch the toys or what have you that you're using as props for speech therapy. So you guys are back doing services in person, maskless, and did you guys see kind of a slower progress when you were having to comply with all the COVID protocols?
Yeah, I think it depends on what the goals were that we were working on. We're working on more, let's say, fluency, which is essentially our kiddos who are working on stuttering, voice quality stuff, language stuff. It really, I think it kind of depended on the child and how much they really relied on that visual feedback. But our kids that were working on oral motor, speech sounds and articulation and all of that, they for sure, I feel like we're making that slower progress because they weren't able to watch and see
right.
those imitations. We use compensations like tactile prompts, which is essentially using our own fingers to kind of, help the kids with their own muscles. But it's hard to even know as a speech therapist, I don't know, is he making that sound or is he making that oral movement the right way? Because they're wearing masks too. So we kind of, as soon as we were able to, kind of like tried to at least in our one-on-one sessions in a closed environment with, air purifiers and windows open, trying to, put our protocols into place, just so we could do the maskless sessions, or for the kids to be able to, get that visual feedback, because we know as speech therapists how important.
Yeah, huge. So for parents who find themselves at home, my husband and I are always like, well, what can we do to support at home, right? Because so much of home, when you talk about speech therapy, sometimes it's like 20 minutes or 30-minute session, right? But then there's the whole rest of the day. And lives. So do you guys have any, I guess it's very broad, a question for very specific issues that every child is doing, but that's one of maybe the tips that, makes sense, right? Where you help them with like, or, stuff like that. Like we actually turned to Miss Rachel on YouTube. She's a preschool teacher, but she was like focusing on speech. And we found that it was often more productive than our speech therapy session, because she would have like, it was like preschool online, and she was prepped for it, not just like the toy that our speech therapist happened to have that my daughter couldn't touch, but it was like, moving things in the back and music, but like, oh, and like, ooh, and so I found myself trying to do that, but I was totally winging it. So are there any tips for parents in general when they're dealing with someone who has speech delays, their little kiddos? Are there any general tips? Perhaps not, I don't know.
Well, I think it can feel a little overwhelming for parents. So first I want to say that, a lot of people get the advice, well, just talk more. And I think that's great in theory, but everybody has busy lives and they have all these things that they have to do, and you're keeping up with your routine, and it can seem overwhelming to say, okay, take extra time out of your day and work on X, Y, Z. Right. But I think a lot of parents miss just the very organic opportunities you have to communicate all day. You're in the bath, you're face to face, you're usually on your knees, so your eye level is right there. And I think that's a great time to work on like labeling whatever toys you have, or, the actions like splash, 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 when water's going down the drain, bye, bye, just kind of really organically bringing things in. And really keeping it really simple. So those one or two words maybe you're really focusing on. I think thinking about what they're interested in, what motivates them, like that's going to be your prime connection language time. So if they love bath time, that works. If they hate bath time and it's a struggle to keep them in the tub, maybe don't focus on language then. Maybe when they're outside in the sandbox or going down the slide or something like that. But thinking about when in your day are you face to face and kind of eye level, and that's going to be a great time to work on language. So that's maybe when you're feeding them, food's a big motivator for your kid, bringing in, talking about, oh, the spoon is coming, just like whatever you have will work. And then can kind of extend it. So maybe mealtime lasts, I don't know, 15 minutes. And then you're like, oh, he's seated, maybe let me bring in some little toys and we'll play on the little table for a little bit while we're face to face. While you're getting dressed or changing diapers can be really.
Well, every activity, right, is always a learning activity with these little ones.
It's so true. And there's always one or two words that would be really helpful for them. I even think sometimes car rides, right? Like, let's sing some songs in the car ride. Let's maybe turn the radio off and we'll just sing Wheels on the Bus or something like that. Or we'll talk about things we see in the car. I mean, anything can be a really great time to work on some language.
Well, that's good, because you're right. It does take the pressure off of parents to just live and kind of narrate your life, right?
Keep it simple. So it doesn't have to be this huge thing. You're making up a story about everything. But even those exclamatory sounds like, uh-oh, oh no, like if you spill something in the kitchen and it's a big mess and you're frustrated. I mean, that's awesome. Oh no, it fell. Like all of that. Wipe all of that. Yeah.
And as they get older, they start to want to play more too. And I think that those are really the best opportunities, is when you're just on the floor, just playing with the kids and, like rolling or having, these more elaborate, like when they get older, they start to have all these great ideas. And so expanding those ideas, like, oh, let's do we're going to go to outer space. What do we see in outer space? What are we going to do when we get there? Kind of using all of your imagination is like such an incredible tool and incredible skill that I think a lot of kids are lacking these days. So I feel like that's a great way to tap their cognition and their ideas and their ideation and all these great higher level brain waves, as well as communicating and language as well.
So it seems like getting back to basics is a good thing.
Honestly, simpler and more open-ended the toy, the better.
Right. My favorite are blocks.
Yeah, exactly.
They're awesome. And to see their imaginations come alive is so cool. But then see them totally transfixed on a screen, it's like, ooh. It's hard. But there are some, good things. And in COVID, it was kind of like we were, parents and working and therapists, and I mean, it was a lot. And so it's like we were able, we found that Miss Rachel was in many ways more engaging and constructive than what we were doing with what we were having to do. So I mean, it's not all bad, but definitely I think back to basics is awesome. So thank you guys for all the go ahead, Michelle.
I say the quality of the TV show helps. Like, you have to have them on a screen for a little bit. Like, life is busy, sometimes you have to. And I think the quality of the show can be really helpful too. I know there's some good research on Daniel Tiger having some good language there. Just for example, I'm sure there are more. Yeah.
Okay, so Daniel Tiger, and then you should check out Miss Rachel. She was good. She did Icky Sticky Bubble Gum and open and down up. It was like all sing-song, but it's for some reason it's engaging, and I actually probably watched a little bit too.
How music really just activates you in such a way, and kids just are just drawn to music, which seems like such a simple thing, but they really are. It's engaging enough for them.
I think it also taps into the other side of the brain. I don't know. This has been a very brainy corpus callosum, both sides, left, right, left. I don't know. Interesting. Well, I'd be curious to hear about what they think about the left and right hand. But thank you guys for the session today. I appreciate it. Yeah, we'll have to do another session and figure out, is there truth to that? Well, thank you for your time. And again, for everyone listening, hope you guys got some tidbits. And if you do have a concern, reach out, start with a PED. It's a great place to start. And there are people like Janki and Michelle who are just ready to help your little ones be the best they can be. So thank you both.
Thank you.
Thank you.
Take care, guys. Bye-bye.
Bye.